Hello people, in this video we are looking at some scrambled words from gynecology. Try your luck at the first one, guys. What do you think this one is? The clue is it is a structure that you see here. It starts with an F. Yes, fallopian. Very good. Let's go to the second one. What do you think this one is? Again, a structure that you're seeing here starting with a V. Vagina. Those were very easy. So let's go to the third one. And the third one is, what do you think this one is, guys? It is starting with a C, a fungal infection, candidiasis. Very good, guys. Let's go to the fourth one now. What do you think this one is? It starts with an S. It's a syndrome, Dash syndrome. Basically here there will be pituitary issue, isn't it? So what do you think this one is? Starts with an S. It says Sheehan syndrome. Basically this is a postpartum pituitary gland necrosis, Sheehan syndrome. Going to the fifth one now. What do you think this one is? Clue here is that it starts with a G. What you're looking at, genital. Very good. So hope you got that right. Coming to the sixth one, guys. What is this? I'm guessing it is starting with an A. Sorry guys, it starts with an A. It is something to do with absent menstrual cycles. Or Hoya. Very good. Go to the seventh one, guys. What is this one? It starts with an F. It is a benign tumor, fibroid. Very good. Leiomyoma also. What is the eighth one, guys? Guess this. It starts with a C. Basically an ovarian cyst. Right? Not ovarian cyst. Some ovarian condition. Endometriosis. You would have seen that in. So this is starting with the C, guys. What you love to eat? Chocolate. Very good. Chocolate cyst. Right? Coming to the ninth one, guys. What do you think this one is? Starts with a T. Something to do with the placenta. Trophoblastic. Very good. Let's go to the 10th one. What do you think this one is, guys? I'm guessing this is starting with an M. And ovulation pain. It indicates Mitzel-Schmerz. Very good, guys. Let's go to the 11th one. Great. You have finished 10. That is a huge achievement. Gynecology, scrambled words. Let's continue. 11th one, guys. What do you think this one is? Take a guess. Starts with a P. PCOS, polycystic. Very good. 12th one here. It's starting with C. It's the name of a drug, ovulation. It helps in infertility. Clomiphene citrate. Very good. What is 13th one? Try it, guys. It will improve your gynecological vocabulary. It starts with an S. Cervical mucus. You can check. What is it? How stretchy it is. Spin Barkett test. Very good. Coming to the 14th one. Do you know this one, guys? It's a small word. Begins with W. Amine odor test. You're going to add potassium hydroxide to a sample of vaginal discharge and you will get a fishy odor. This is indicating bacterial vaginosis. It is a whiff test. Very good. Coming to the 15th one. What do you think this one is, guys? It starts with an F. It is a surgery, name of an operation, surgical procedure, where you're covering the amputated cervix with the vaginal mucosa, vaginal wall, and that is the Fothergill operation. Very good. Try this one. 16th one here. You think it's easy? Try. It's just starting with a G. It's the number of weeks of pregnancy, or it is pregnancy as such. Gestational. Very good. Let's try this one. 17th one for you. Very easy. Anatomical structure that you're seeing here starts with a C. Yes, you got it right. Cervix. Let's go to the 18th one. What is this? I'm thinking it starts with a D. It is the teratoma, Dermoid. Dermoid cyst, usually ovary, but it can happen anywhere else also in the body. What is this one, guys? A huge word. Whoopsie, whoopsie, whoopsie. Let's just make it like this. Yeah. What do you think this one is? You can see the answer a little, is it? So basically it's a combination of 3 words, right? The uterus, the fallopian tube, you're trying to do an X-ray, starts with a H. So the answer is hysterosalpingography. Very good. 20th one already. Great. It looks very easy to me. I feel it starts with an L. A procedure that you do using a camera, laparoscopy. Very good. So we are done with 20, guys. Amazing, guys. We finished 20. Another few to go. Let's look at this. Let's go to the 21st one. I think we have around 60. Okay, look at this. I think this is not difficult. It is starting with a B. It's 2 words. Contraceptive. Yes, birth control. Very good. See if you can answer this one. I think it's very easy. It's the same word that you are trying to solve now. Starting with a G. It's the study of the female reproductive system, female reproductive parts, genitalia, gynecology. Very good. 23rd one here. What is this? Oops, we meant to reduce the size. What is this? Yeah, this one. Starts with a G, guys. Something to do with milk production. Galactorrhoea. This is abnormal, right? Milk production when there should not be any milk production. Discharge from the breast actually can happen in men or women. Now let's go to 24th one. And this is something to do with contraception again. Starting with S. Something like disinfectant also it can mean. Sterility, right? Very good. 25th one. What do you think this one is? I feel it begins with a C. Something to do with the bladder. Coming out with the uterus. What do you call that as? Cystocele. Very good. Coming to the 26th one, guys. What is this? I think I can guess what this is. Some drug name. Starting with an M. You give it for inducing abortion. Mifepristone. What is mifepristone, guys? It is a antiprogesterone, isn't it? So it will, it's RU486. It will cause an abortion in the early days of pregnancy, right? So it is a blocks the hormone progesterone. Okay, let's move on, guys. 27th one here for you. Try this one, guys. It is basically, I think I don't have to give you the starting word at all, right? You already know, but it begins with M. It is a triad of ascites, pleural effusion and benign ovarian tumor. So ascites, pleural effusion and benign ovarian tumor triad. It is Meiggs syndrome. Very good. Now let's go to 28th one, right? We are in 28th one. Yeah. 28th one. Suddenly it feels like Ramesh, but what is this? Gynecological word, guys. It is actually starting with A. It's the name of a syndrome in which, what do you see? You will see wait, I'll give you the clue. Basically formation of scar tissue in the uterine cavity after uterine surgery. Lot of adhesions, right? Synechiae, etc. I'm guessing. So this is Asherman syndrome. Very good. 29th one, guys. What is this? It's a name of a drug. It starts with D. It's androgen, etc. You will give it for atrophy of the endometrium, right? What is this? Danazol. Let's go to the 30th one, guys. Come on, try it. 30th one, you're already there. I think it's easy. What you're looking here at the structure begins with an O. Something related to that. Ovarian. Very good. We're done with 30. That's great. So guys, we're just looking at all the terminologies of gynecology. We have finished 30. Just a few more to go. Let's continue. 31st one here for you. If you're enjoying it, try to crack it. It begins with M. It's a condition associated with menstruation. In normal regular cycles, you have increased bleeding, either greater than 7 days or greater than 80 ml or both. That is menorrhagia. Very good. Coming to the 32nd one here, guys. What is this? It's the name of a disease, vaginal. It starts with a T. It is protozoan, if I'm not wrong. It is trichomonas. Trichomonas. Coming to the 33rd one, guys. What do you think this one is? I'm guessing that it's again a name of a disease, and that is sexually transmitted and starting with a G. Yes, it is gonorrhea, caused by Neisseria gonorrhoeae. 34th one here for you. What do you think this one is? It begins with a C. Again, it is a single word associated with birth control. This is contraception. Very good. Go to the 35th one, guys, here. What do you think this one is? It's a condition starting with M, coming after 50 years in women. Menopause. What is this one? I think it's easy. Come on, try it. It's the name of a hormone starting with P, I'm guessing. Progesterone. 37th one here. What do you think? Suddenly when I look at it, I feel like it's a polyp or something, but I think it starts with a C. Something to do with the vagina, a laparoscopy, no, some kind of a procedure, colposcopy. Very good. What is this? Try to guess. This is the name of a seminoma of testis equivalent in ovary. Germ cell tumor, most common. Dysgerminoma. Very good. Coming to the 39th one, guys. We're almost at the end, don't worry. This is the name of a stain starting with P. So it is used for pap smear. Papa Nicolau. Papa Nicolau. Very good. Papa Nicolau. What is this one, guys? It's an organ which is coming out from its normal place. It's kind of displaced from its normal place. What do you call this as? Starts with P. Basically, it is used for the pelvic organs. Pelvic organ slips down from the normal position and bulges into the vagina, you can say. Prolapse. Very good. So we're done with 40. 20 more to go, guys. Our target is 60, isn't it? Around 60. So let's look at the 41st one here. Ready? What is this? A long name. I feel like it starts with a C and looks like a carcinoma to me of related to the placenta. Choriocarcinoma. Very good. Let's go to the 42nd one here. Looks like it is starting with a B. And what do you understand here? It's a gland name. Did I tell you that? Bartholin. Very good. 43rd one, guys. Focus. Bean, like Mr. Bean. What is this? It's the name of a tumor. It is Brenner tumor. Very good. Did I tell you that it starts with B or not? Okay, look at this. What do you think this one is? It starts with a C. And it is something that after the Graafian follicle release the ovum, it will be there. It will secrete progesterone. Corpus luteum. Try this one. Something where we use that stain. Starting with P. Pap smear. 46th one. What do you think this is? It starts with S. So it is some bodies you find some Schiller test is also there. Schiller dual bodies are also there in gynecology. Basically, Schiller dual bodies you will see where yolk sac tumor. But what is Schiller test? Schiller test is something like you will test for the uterine cervix, right? You will check the iodine and all you will put and check, right? That is whether it has glycogen, isn't it? So that is Schiller test. Okay, two things are there. Schiller. Coming to this one, what do you think this one is? Take a guess, guys. It begins with are we looking at the whole thing? Yeah. Starts with M. Am I saying it correct? But why it looks like monthly cycle? What is it? Menstruation. Very good. That was kind of confusing. What is this? I think I can guess it. The organ that you're looking at here starts with a U if you want a clue. Uterus. Look at this one now. What do you think this is? Anatomy. Again, starts with P. Pelvis. 50th one. We're almost at the end. Great. What is this? Starts with an E, kind of 2 words. It is endometriosis. Very good. We're done with 50. Just 10 more to go. Yay. Gynecology, we'll become experts. Okay, what is this 51st one? It's something that cervix does. Okay, starts with a D. Yes, dilatation. 52nd one here. What do you think this is? Starts with M. It's the name of a drug. Methotrexate. Why do you give methotrexate? For all these carcinomas, etc. You give methotrexate, isn't it? Then antimetabolitis. What is this one? Starts with a C. Dilatation and curettage. Very good. 54th one here. I think it's an anatomical structure. External genitalia. Female. Starts with a V. Vulva. 55th one. What is this one? Starts with a P. A drug that you insert into the vagina. Pessary. Okay. What is this one? It starts with an A. It's a condition of the uterus. Again, adenomyosis. Coming to the 57th one here. What do you think this is? I think it begins with I. And it is a negative word. So it feels like a negative word to me. What do you think this one is? When they cannot conceive, they cannot have children. Infertility. Very good. Well, there's nothing like infertile now. There are many methods to get children. Right? What is this? Yeah. So, condition of the uterus. Starting with P. Pus in the uterus is it? Pyometra. We're almost at the end. Try this one, guys. Just 2 more left. Try this one. Starts with a U. Something to do with urine. What is the word? Urinary. Very good. Try this one. I think it's easy. Something to do with the uterus again. And this is one of the treatments you can give. Starting with an M. Myomectomy. Okay, then the last one. Come on, try this one. 61st one. This is starting with H, and it is like a radical kind of procedure, something that you do here, removing the uterus. Hysterectomy. Very good, guys. You have learned so many words from gynecology in this video. Hope you enjoyed it. Bye bye.